Welcome to the Counselling Tutor Podcast, the must-listen-to podcast for students of counselling and psychotherapy. Here are your hosts, Rory Lees-Oakes and Ken Kelly.
Hi, I'm Rory, and with me, as always, is Ken. And can I ask you, Ken, are you well?
I am. At the time of this recording, I am. And yourself, Rory?
Everyone here at Counselling Towers is fit as a fiddle, I can say.
Glad to hear it, and wishing you and your family well listening to this as well. This is episode 147 of the Counselling Tutor Podcast. We've got three topics we're going to be discussing today, starting off with our introduction topic, which is power in the counselling relationship. We're then going to check in with our good friends at CPCAB, where, Rory, you spoke with Heather Price about the issuing of qualifications.
Yes, it's always a bit of a mystery how the certificate or the diploma or your qualification actually arrives. And we went with our good friends at CPCAB, and we've pulled the curtain back to see the process of what happens when you pass your qualification and your certificate is issued. What is the mechanism that happens? And it's a really inside track into how awarding bodies work and how qualifications are issued.
I always love a peek behind those curtains, Rory. And our final topic for episode 147, we're going to be speaking about keeping professionally motivated during the lockdown. This is Practice Matters. It's our section where we discuss what we might see in practice, and we kind of aim that at our qualified friends out there, keeping professionally motivated at what could be, I guess, a challenging time. But let's kick episode 147 off with power in the counselling relationship. If I remember correctly, Rory, this comes up again and again and again in assignments, but it is something we really need to consider deeply.
We do, and I think that it's something that isn't often talked about to any great depth. And if you think about it, we try and balance the power out in therapeutic relationships. We're not like, Sigmund Freud, who was the doctor expert who would sit and analyze the analysand at the time of Freudian psychoanalysis, and hold huge amounts of power and send wise words to the client and give advice maybe. Modern counselling is about autonomy and trying to make sure that the power balance is equalised out. But there are some areas where we can't equalise power, and one of those, of course, is us holding confidentiality. There are certain aspects of law, certainly here in the UK, where we're legally bound to break confidentiality. And of course, if someone's working in an agency, or either as a student or maybe they're employed in an agency, their agency's policies and procedures may preclude complete confidentiality, if there is anything like complete confidentiality. Things like harm to self and harm to others are usually markers where the therapist would have to break confidentiality. So that tips the balance in the therapist's favor, doesn't it?
I can see that. Yeah, it does, because it's kind of it's equal unless something is shared, and then I need to X, Y, and Z, which, as you say, it tips that power balance. And I think power is an interesting topic right from the very beginning. And I wonder how clients are when they are thinking about going into therapy, what their perception of counselling might be. And I wonder whether they kind of see it in their mind's eye as I go in, I tell the expert what I'm struggling with. The expert gives me all of the answers. And I wonder if there's not a perception of a power imbalance pre-therapy. And I guess taking that into consideration and being mindful of that, how we work with a client when they first arrive with us on that first kind of contact.
Yes, and certainly in my experience of practicing for nearly 20 years now, is that can happen. Clients can come thinking you're going to give them advice, almost a little bit like reparenting. And part of that is to acknowledge what they want and not dismiss it or discount it, but also help them gain the autonomy to make their own decisions. And sometimes, a small discussion around what your roles are, what a counsellor's role is very useful at the beginning. I usually say, well, I don't give advice, but and I say with sincerity, I believe that you have the answers, and maybe we find them together. That usually is a conversation that works quite well. Certainly with adults, it's a little different when you're working with young people, I have to say. But certainly when you're working with adults, people can come along, and usually when people come, they're used to being depowered. If people are asking for advice, they're used to being depowered. So seeing someone who hasn't got any power or has limited power can actually get them to harness their own power, to sit in their own power. So I think that's an interesting process. And of course, Ken, power is a pretty benign thing. It's like a knife. You can use a knife for a lot of things. You can use a knife for cutting your cucumbers, or you can use a knife to stab somebody. It's a benign object. It's how it's used. It's the intent. And the same goes for power. So power itself isn't a bad thing. It's the way it's used. Yeah.
It's just interesting that there is that perception of that power imbalance, that we need to look at it, we need to consider it. We certainly need to do that as a student, because we write about it in assignments, but we need to be mindful of that, I guess, as we go into our own practice, because it's easy to forget these kind of topics and just business as usual. And I think that it kind of starts with that first outreach, how the client finds you. Is it a website? Did they phone an agency? What was their experience in that? What's that first, if you're doing face-to-face, what's that first meeting like? What are the chairs like in the counselling room? How is that laid out? Do they have a choice of where they choose to sit, or is there a designated counsellor seat? And those are the kind of things that interest me. I remember working at my placement, Rory. I was in a medical centre, practicing, and basically it was set up as a doctor's consulting room. That's what I was working in, and the doctor's chair was this big, comfy black leather chair, and the chair on the other side of the desk that would generally be where the patient would sit and kind of say where they were at was just like a little school chair, almost smaller. And I'm sure that wasn't done deliberately, but it didn't work for me in terms of counselling. I needed to go to other rooms to get chairs that were the same, to lay them out, so that there wasn't this power indifference kind of brought on by the chair. So if you know the television program Mastermind, they kind of have a chair as their kind of introduction. It was kind of one of those chairs. You could almost hear the music when you looked at the chair, Rory. And it's those simple things, isn't it?
It is, and I can remember working in much the same environment as you did, Ken, where there was a desk and a big chair and a little chair, and the client came in, and I put a small chair out, and I said, I'm just going to get another small chair and put them, in front of each other. And the client said, why aren't you sitting in the big chair behind the desk? And I said, well, and we had to explain that. And actually what the client said was, is this a wind up? Are you kind of tricking me by sitting in front of me? Ooh. And I said, no. I said, tell me why you would think that. And it was just purely the expectation that I would be in the huge big chair with the huge amount of knowledge, and I would be, I'd be pontificating to the clients. And it took a little bit of just a gentle conversation initially to just say, look, this isn't how counselling works, and we're equal as best we can be. I'm here to hear what your difficulties are, and we'll try and work it out together. And I think it links into another universal truth about power. Clients come to us because they've got a difficulty. So that tips the balance in favour of us slightly. And they come at a time usually that we say, we usually set the times and the location. So that can tip the power balance. So yeah, I don't think we can really balance it out completely. But as long as we're aware of the misalignment, I think that we can work with that.
I agree with you, and it's interesting when I looked at the topic at first, I kind of thought, well, how do we eliminate power in the counselling room? We can't. By the very nature of a person's perception of what counselling may be, by the fact that they're coming to us and bringing their problems to us, there is that power imbalance. It's about how to address, I guess, that power balance, how to recognize it and work in service of the client, because once you have that rapport, if the rapport is set up correctly, it's interesting that all of that seems to fall away. The room falls away, and it just becomes two human beings sat together, with one sharing their journey, the other one being with them on that journey. And within that moment, within that special bubble, it's almost like that power falls away. For me, that's how at least I perceive it. But there's quite a lot of work in recognizing the power balance and being mindful of it, and working, I guess, in the autonomy to the autonomy of the client.
Yes, and there are some benefits, Ken, of retaining power. I think sometimes if you get clients who have very, very wobbly boundaries, then having a session, and if the client turns up half an hour late, saying to the client, well, we set the time at XXX o'clock, and you're late, well, that's okay, that happens, but I could only see you for, say, half an hour. Or maybe if someone turns up 3/4 of an hour late, resetting the appointment, I think is very useful, because sometimes that power can be used to help people stabilize themselves and set their own boundaries. And I know in my practice, I've had people come in who are a little chaotic maybe, and I'd be waiting, and they'd come in 3/4 of an hour late, and I'd say, well, we set the appointment at such a time, I've got another client at 3 o'clock, and just saying to them, maybe next week, and how is there anything I can help you with, just to make sure that you remember the time, give you an appointment card or something. And sometimes that stabilizes people out. And I think that's a hidden function of power in the counsel relationship, as is protecting the general public. I've had instances where I've had to break confidentiality, where I thought that a person I've never met's life was at risk. And I had to call that and make a defensible decision that, if I didn't break confidentiality, someone I never met could be in very serious risk. So there are benefits of retaining power. But as I say, power is a pretty benign thing. It's how it's used.
Yeah, and I guess those benefits are really important to kind of look at, recognize them. On the other side of those benefits, I guess, things that we should be aware of are things like a good friend transference and counter-transference. If there is a perception of power from the client coming in, seeing us in a position of power, who is that power directed at? Is it an old school teacher? Is it somebody from their past? And how might they react within that situation? So I guess that's one of the things to be mindful of, and a topic that you bring up every now and again, Rory.
Do I?
You do?
Really? Yeah, yes, that's a whole other podcast about person-centered therapy and transference, but it does happen. It does happen where people see you as someone else from their past, and you have to rework the transference. If you're feeling that, you say, who am I to you? Oh, you remind me of my teacher. Well, I'm not your teacher. Or, I had someone recently say, you remind me of my abuser. And we had to have a conversation about, well, I'm not your abuser. I understand why you might think that. I physically look like him, but I'm not. And rework that transference into the here and now. And of course, the way that the ultimate tool for balancing the power out the best we can, of course, is the contract. Because with a contract, we give the contract to the client, and they can decide, have the autonomy to decide, after reading the exceptions to confidentiality, the appointment times, the amount of sessions, if they want to proceed. That's giving them the power.
Oh, I enjoyed that, Rory. I almost don't want to move away from that first topic. I think we could spend the whole podcast on it, but we have to move on, make some headway. We are checking in with CPCAB. You spoke with Heather about issuing those qualifications. I'm very mindful, Rory, as we kind of cover this topic, that I'm starting to see dripping into our Facebook group, which is a group of tens of thousands of counselling students, counselling tutors, qualified counsellors, supervisors. If you're not in that group, look us up on Facebook. Just put in Counselling Tutor and come and join the group. That people are starting to show their certificates and go, yes, I've got my qualification. And I remember that kind of when I first started my training. It was all about the certificate. As it got near the certificate, it was less about the certificate, funnily enough, and more about the learning I'd done and what benefit that would make in practice. But the issuing of those qualifications was an absolute mystery. You'd put in your assignments, and then through the door would come an envelope, perchance with the certificate in. You've lifted the curtain, Rory.
It's like magic, isn't it, Ken? It's a little bit like magic. It's almost like they appear out of the ether. Yes, and it's really interesting to see the process that awarding bodies go through, certainly here in the UK, in the process of getting the results and then issuing the certificate. And I have to say, I'm with you, Ken. When I started, I dreamt of standing with my flat cap and my certificate. I never got the flat cap because we didn't have a graduation at my college. And also my certificate's got my name spelt incorrectly. But, it didn't really matter at the end. But it's arrived, and it's the process of arrival that Heather is going to explore.
Let's dive into Check-In with CPCAB.
Check-In with CPCAB.
And we welcome Heather back from CPCAB. And we're going to be looking at something that's quite important for a lot of students, issuing qualification results, the process of that. So what does that look like from CPCAB's point of view?
Well, I think there's quite a lot in this, really, because I think sometimes students think that we, as the awarding body, issue the results directly to them. And in fact, we don't. It goes through the centre, the training centre, college or whatever. So we, as the awarding body, our contract is with the centre, but as students, your contract, agreement, if you like, is with your centre. So it's the centre who will actually give you your results. But I guess there are several steps in that process before you will get your certificate or diploma, which might be at a different time when you know your results, if that makes sense.
Absolutely.
And I can explain that a little bit more.
Yeah. So what I'm hearing is that the first place of contact for the "Have I passed?" question should be your training provider, not phoning up CPCAB, because as a student you contract with your training provider. But there may also be some other steps after you've heard you've passed, before that qualification, that nice certificate lands on your desk or you collect it. So what are those steps?
Well, there are steps before and after that stage. So with CPCAB, we have internal assessment and we have external assessment. And a student has to pass both of those in order to meet the qualification requirements and get a certificate. So the internal assessment results really mean, has the student completed everything in their portfolio? Certainly for the lower levels. For the higher levels, it would also include, have they done all their client hours or supervision hours? So usually you as a student would know whether you are meeting those requirements. You would hopefully have had regular tutorials. You've got your own portfolio and the candidate learning record to look at. You will know if you're on track to meet the internal assessment requirements. So it should not be a shock if the tutor says, well, actually, you haven't met all the requirements yet because you haven't got evidence for all the criteria, for example, because you would know that and would be working towards it. So in a way, it's not the case of having to get a result. You would know on an ongoing basis throughout your course how you're doing. Having said that, your tutor will sign off your completion statement in your portfolio to say that you have met everything. Next part then is passing the external assessment, which is like an exam. We call it external assessment, but it's like an exam. And you could take that possibly just before the course ends, the teaching part of the course ends, or maybe just after the teaching part of the course ends. And that is something which CPCAB marks and gives the result to your centre. That's the result that you would have to get from your centre, not directly from CPCAB.
Right. So there's a process in this, isn't there? That there seems to be two pieces of work, certainly for the higher levels. The first is an internal portfolio that needs to be completed. And I think, as you say, students should have good contact with tutors who'll tell them if they've got any assignments outstanding or any criteria outstanding. And at any point within the academic time or the academic years, if it's a 2-year course, students should have a rough idea of what they have to do and what they still need to do to complete that internal piece of work. And then the external portfolio is something that's marked externally. It's not marked, the exam itself is not marked by the tutors, it's marked by yourselves.
Yeah, that's right. That's right.
And that result will be transmitted directly to the to the centres for them then to speak to the individual students and tell them if they've passed.
Yeah, and different centres perhaps do it in slightly different ways. If it's a college, it would be usual for those results to be uploaded for the exams department to look at online. Tutors may have access to that as well, or the exams office may disseminate those results to the appropriate tutors. And then the tutors let the students know in whatever way they normally do that. So that's the process of the external assessment results getting through. As far as we're concerned at CPCAB, if a student's portfolio has been signed off by the tutor and everything is complete, then the tutor, or maybe the exams department, uploads that internal assessment result onto our computer system. Nothing happens right then. It just sits there until the external assessment result goes on the same part of the computer system. And if both are passes, that generates a certificate. And the certificate is printed and goes to the centre. Go on.
Yes, I was just saying it is a very straightforward process, isn't it? That you have to get the internal unit passed and the external unit passed, and once those two are passed, that then generates the overall pass, and the certificate is popped in the post or however it gets its way to the centre, and that is the pass for the course.
That's right. That's pretty straightforward if everything is a pass, but I guess complications can come in if, say, a student has not finished their portfolio work, and so the tutor can't upload that result as a pass because it's not finished. So they would normally have a deferred next to their name, which suggests to us that they are still working on it and they're going to finish it some point very soon. In the external assessment, if the student has not passed the external assessment, that's written down as an NP and not proficient. And the student is quite likely going to resit that at the next window opportunity. So if they have actually passed all their portfolio work but not passed the external assessment, they won't get a certificate until they've done a resit of the external assessment and passed it.
Yes, so that's really clear, isn't it? There's someone could be held up, if you like, because they've not passed a part of the criteria for the internal portfolio, or and they could have actually, I presume, done the external piece of work that's marked by CPCAB and passed it. But until both of the units, the internal and the external, are passed, then nothing happens. In terms of a deferment, how long can people defer for? Is there a kind of criteria or a policy on how long people can defer?
Well, at the lower levels, we say that they should have finished their portfolio work within 3 months of the end date of the course. In theory, we can refuse to certificate if it's gone beyond that date, but sometimes there are extenuating circumstances. And if the tutor, not the student, but if the tutor emails us or phones us and lets us know why there's been a hold up, and maybe that student needs a little bit more time. And say they've had a bereavement in their family or something that's really stopped them doing the work, then they might need another month or so. But really, we wouldn't be giving much beyond that, because primarily the work at levels 2 and 3 is done during the course and, well, ceases to be so relevant if it's being completed after the end of the course. Higher levels, it's a little bit different, because the thing that tends to hold it up is that students are doing their client hours, and they might well not have done those within the duration of the 2-year level 4 course or the 1-year 5s or 6s. So they need extra time. So at CPCAB, we allow them a year extra on those levels 4, 5 and 6. If they've not finished everything within that year, then the tutor must apply for an extension for them. Again, citing extenuating circumstances, not just because they've been lazy.
Yes, and I think that's a real call to action, Heather, to be honest, because as a former tutor, I know that some people have taken a long time to submit work. Some of it because they've had extenuating circumstances, but some is because, shall we say, they lack motivation. I'll be polite and say they lack motivation. But that makes it really, really clear. And I also think that that it's really useful for students to understand the certification process. The idea that the certificate and who to speak to is actually their tutors and their exams department, not to contact you, because I suspect there'd be a polite refusal and a redirection.
Yes, yeah, because we don't know the student, we haven't got the relationship with the student that the tutor has got. In theory, a student could ring us up and tell us anything, and we don't know whether that's true or not. But the tutor knows that student's circumstances and issues, what's going on in their life, and they know whether asking for some more time is a genuine request or not. And I think for tutors and students that are listening, for tutors, we have a form for you to fill in on behalf of your student called a CR11 if you want to ask for more time beyond that 1 year. We will then look at each one on its own merits. So we don't say, well, there's a definite cut-off point here or whatever. We'll look at, well, what are the circumstances? Why has that student not finished their hours? Because it's usually hours. And we'll discuss that here at head office and make a decision. For students, because sometimes there's a tendency after the course is finished to kind of go away and think, oh, well, I've had enough of that and I haven't passed and that's it. And then 6 or 8 months later think, oh, but I only had a bit to do. I could go back and finish that, or I could finish off those 20 hours or whatever. But make sure your tutor knows, because your tutor needs to be asking us for an extension, and you need to kind of chivvy that along as a student. But if you've got special circumstances, then you need to be asking your tutor to apply to us.
Yeah, so again, the message there is take responsibility. If you think you may not be able to engage in your studies for legitimate reasons and extenuating circumstances, keep in touch with your tutor, and your tutor will file that form, which will allow an extension. So Heather, it's always wonderful to talk with you. Learn so much about the ways of how CPCAB work and the internal workings of an awarding body. So Heather, thank you very much.
Thank you, Rory. Thank you.
Check-in with CPCAB is proudly sponsored by CPCAB, the only awarding body run by counsellors for counsellors. To learn more about CPCAB qualifications and to get more detailed information on today's podcast topic, visit cpcab.co.uk.
Well, it took the magic out of it, really. I just thought they materialised out of the air. I thought the certificate fairy brought them, but clearly not. As always, we're eternally grateful to our good friends at CPCAB for opening up their processes, being transparent, and sharing with everybody how this works. I think it's just so useful to understand the process.
Indeed it is, and we end episode 147 with our final topic, and this is, we call this section Practice Matters, kind of dip our toe into the day-to-day running of a practice, so maybe aimed at our qualified practitioner friends. But it's a tricky time at the moment. At the time of this recording in the UK, we are in lockdown. I'll be honest, Rory, I'm feeling demotivated. Even today, it's like a tire that is not fully pumped up. I just feel a little bit off. It's when the lockdown started, I was very motivated of all the things I was going to be doing during the lockdown. And I find that I'm less and less motivated as one day just seems to blur into another and one week blurs into another one. And we wanted to address this keeping professionally motivated during the lockdown.
Yeah, it's just so many changes since the lockdown. I mean, our professions has been a very traditional profession to a great extent. We've seen clients face to face. We've gone to CPD events. We've joined our ethical bodies. And, you know, since the lockdown, of course, all that's changed. And I don't know about you, Ken, but I'm struggling to know what day of the week it is. I'm having to go to my diary.
Yes.
I press the button that says today, and I go, aha, it's Tuesday. Because the markers in my life where I did things on certain days are starting to kind of blur or move along. And I'm sure it's the same for other people. So it's really important that we don't let that slide into our professional lives. If we're still practicing, we have professional obligations, and here in the UK, that's 30 hours of continual professional development a year. And it might be a time just to have a look when your last CPD cycle started and where it ends. And you may be a bit concerned that your CPD cycle is coming to an end and you've not done 30 hours. And of course, online is the ideal way of getting CPD. You know, we're not going to be going, I don't think, to face-to-face conferences and meetings, certainly in the short term. So online is the way to go. And of course, you know, people, you know, I understand that people may be looking after children and some people may still be working, but, you know, it is a very, very convenient and very good way of getting CPD by just finding an online CPD provider, Kim.
Yeah, and of course, there are many online CPD providers out there, of which we are one. If you want to look at our online CPD provision, we have a mega library of over 150 hours of formal lectures, all linked to learning outcomes from some of the top names in counselling. And you can get more information by going to counsellingtutor.com. Even if you kind of just take a month's pass and just have a look at what's available there to use your time constructively. But I've been thinking, you know, the running of a practice, if you're running your own practice, is really busy. When I was in private practice, there were never enough hours in the day, Rory. That was kind of how it was. When working in an agency, it was pretty much the same. It was up early in the morning, it was out, it was to the agency, it was back exhausted at the end of the day, looking forward to those weekends for a little bit of downtime. And during those busy times, it was more difficult for me to fit in CPD, to read a good counselling book, to maybe listen to a podcast like this one that you're listening to at the moment, to maybe get online with an online community like a Facebook group or something like that, because there was little of me left after I'd serviced my practice and my agency. And I guess that if there's a small benefit to not being able to be out and doing face-to-face work, is that it gives us time. But with that time, I guess, comes the responsibility of how we use that time in service of ourselves, our practice, and of course our clients. I've noticed as I kind of go for my one daily walk, Rory, which we're allowed here in the UK at the time of making this recording, I'm seeing lots and lots of very clean cars, very neat gardens, as people are using their time kind of focusing it there. But I guess there is time, if we choose to use it now, to kind of load up on CPD, do some self-care, network, read a good counselling book.
Absolutely. And you know, I was thinking the other day, if this event that we're living through had happened 20 years ago or 25 years ago, where would we be? Because we're not in a wired world. We weren't in a wired world as such. The internet kind of existed in its own infancy. But nowadays, there's so much that you can access. and you can keep in contact with people. I mean, Ken and myself, I'm looking at Ken through the studio glass, and that is the monitor of my screen. He's 40 miles away. So, there's so much you can do online. And I think it's sometimes useful. I am sure there are times when people have said to themselves, I know I have, Ken, I wish I could find out a little bit more about that theory. Or how would I put that kind of that intervention into practice? No better time than now, because if you have a bit of time on your hands, you can find out, you can build your CPD kind of repertoire up, and you can find the things you're passionate in. So maybe taking a positive out of a very difficult situation.
I mean, we've been running the online and telephone counselling course that we kind of implemented right at the beginning of lockdown to help counsellors transfer skills from face-to-face work to online work. And what's really interesting from that, Rory, is in the comments that are coming in, is how many people are saying they're so grateful to have something positive, something to look forward to, something to be part of during this lockdown time. So there is, I guess, some solace in diving into something. But of course, not everything needs to be paid for. You mentioned how we're meeting right now, Rory, and we're using a little application called Zoom, which if you haven't heard of it, go onto Google, put in Zoom, and you'll see it. It's free, and we connect multiple times a day. Sometimes we'll do it for Counselling Tutor Business, but other times we'll do it for a quick catch up and how are you doing, and a bit of a chin wag. So I think there are opportunities to network with colleagues over Zoom, even if it's just for a cup of tea. Read a book together, both kind of choose a book, read it, get together, chat about how that is. So I guess the first step for me would be saying, okay, let me sit down and make a list of all the things I could be doing, and what are the goals that I want to have achieved when I come out of this lockdown period, because we will come out of it.
Absolutely. And I say, don't be alone. I think the worst thing that can happen is for a practitioner to practice in isolation in a bunker or a silo, and not be connected to the outside world. As professionals, we need to be connected. We need to meet with other professionals to share ideas. I'm always talking to other colleagues, be it through video link on the phone, sharing ideas, talking about theory, keeping the theory vibrant, because I'm still in practice and I still have to offer a high quality service to my clients. And that's the only way I can do it. I would hate to just be isolated off and not be able to use colleagues to gain a professional insight into something. So stay connected, I think, is the message there.
Yep, we've got lots of free resources on our website, counsellingtutor.com. That's also the URL to go to if you're interested in any of the paid for services that we offer, whether that be self-directed study support for students during the lockdown when you cut away from your college. If you're interested in our CPD provision, we're offering that at the moment for £14.99 for a month's access to the entire library, which includes things like skills, where you can kind of really deep dive into the skills, revisit theories, as Rory has said, or look at client presentations, substance misuse, working as a couples counsellor, working with children. So much in there if you're interested in that, or our online and telephone counselling course. All of the information is at counsellingtutor.com, along with loads of free information, links to our Facebook group, which is also free. This podcast is free. So hopefully enough for you to be busy with during this lockdown period that will give you some form of a positive outcome, something to look forward to, something to get your teeth into.
Absolutely. What an interesting podcast. We started off with powering the counselling relationship. We drew back the curtain of qualification issuing with our good friend Heather Price at CPCAB. And finally, we talked about keeping professionally motivated during the lockdown. So as always, stay grounded, stay safe, and stay indoors.
Take care.
Thank you for listening to the Counselling Tutor Podcast. Find the show notes for this episode on our website at www.counsellingtutor.com.